Province and communities ramp up testing for COVID-19, pressures on the laboratories to process those tests as quickly as they can. Joining me now with how the lab professionals are coping is Michelle Hoad, the CEO of the Medical Laboratory Professionals Association of Ontario. Michelle, thanks for joining us.
Thanks for having me.
So, as I understand it, there are a number of categories of labs: university, research, commercial, clinical, hospital, pharmacy, even veterinary labs. And doing some research, I saw that, early on in the first wave of COVID, Germany's a country that did a great job at commissioning the veterinary resources right from the jump, and it helped a lot. So, we have only activated and scaled up a couple of those resources. So if testing volume speeds up, if you don't have the lab resources to turn around the tests, how can public health deliver results in time?
Yeah, it's a very good question. So I think it's important to understand exactly how the whole process works. So public health is actually one section. Then you've got all the labs, hospital labs, and you've got private labs. So at the onset of COVID, so back in March, we actually had 5 labs that were testing. As of today, we have over 50. There are 52 labs testing. So those labs include a lot of hospital labs, so not just public health labs and private labs. What we're finding, and the government's done a very good job at investing in the front end. So what we found was we needed more assessment centers. So we have 150 assessment centers across the province right now. We've invested in medical lab assistants. Those are the folks that you've got nurses that actually take the test, bring it to the assistants insert the data, move the test to the lab. But the core group that we're concerned about are medical lab technologists. Those are the ones who process the test. We started the pandemic understaffed. 77% of labs in Ontario were understaffed before we started. 44% of this group are eligible to retire. Several have taken early retirement. So we are dealing with a funnel. Right now we have all these assessment centers, all these tests coming in. Eventually they will funnel to a core group of people that would do testing. I would like to add, though, that this group has been working 24/7 for the last 7 months. 3.6 million tests done in Ontario is extraordinary.
Wow. Yeah, we talk a lot here about giving props, as they say, to the frontline workers, but that's another group of people now that you've exposed to us that, have been working, above and beyond. And, I was going to ask you next, what is the fire underfoot? What's the blunt instrument here that's going to change things? Obviously, and typically, the answer to every question in these situations is money, but you can throw all the money you want at it. If you don't have the trained professionals to do the testing or to process the testing, that's the problem, right?
Absolutely, George. So what's interesting is there's actually 5 medical lab technologist programs in Ontario. Each of these programs currently have a wait list. It is as simple as asking these schools, let's open up more seats for these programs. And so the other challenge with that is when you go to a program, you then need a placement in a hospital. So we're dealing with a shortage at the hospital, not enough placements. It's hard for them to add more seats. So we are constantly working with the government to find ways. How do we increase seats? How do we get clinical placements? Because this pandemic, as we understand, is now 7 months. Really, how long is it going to last? When's the solution going to come? Is it 12 months? Is it 24 months? So it's not a problem we can solve today, but something we need to look at for the future, for sure.
We hear the term warp speed prefaced when it comes to trying to, expedite the vaccine production in the States and beyond. But really, you can apply that to just about every step of the way when it comes to processing information about this virus. Testing is just data, right? It's got a shelf life, and it's only effective within a couple of days to get that information back, because if you get your results back, let's say 6-8 days or longer, all that's telling me is that I'm sick, right?
Yes, absolutely. Here's another interesting fact that would be interesting for the public to understand is that this group of people is also processing all the other lab tests that are happening every day. So cancer patients, glucose monitoring, lots of other tests that need to happen. So adding COVID-19 to their workload is having a technologist trained on a new instrument, but they still have to process all the other tests they do every day.
Boy. As we're speaking, we're running some live footage right now of long lineups, and they continue outside testing centers, assessment centers at hospitals. Michelle, should the Canadian government do everything it can to expedite approving rapid home tests and kits, even if they're not 100% reliable?
We live in a country that has some pretty strong protocols and regulations, and we need to stick to those regulations and protocols. So there's a reason why those tests are not out yet. There's a reason why in Ontario we haven't actually started to use them, and we, the public, should trust the government to ensure that they're actually following the protocols. We wouldn't want to take something before it's actually ready. What's the point in having a test if it's going to give you a sense of that you don't have COVID when in reality you do? It doesn't help anyone.
Michelle Hoad, fantastic interview. I wish we had more time, but we learned a lot today. Thank you so much.
Thanks for having me.
And coming up